million kids in California live without adequate health care. Marta's 11-year-old son, Edgar, is going deaf.
Edgar! Ven! Ven, hijo. Ven.
Edgar's hearing in the right ear is gone. And if he doesn't get help soon, doctors say he will lose the other ear. The family of 4 picks grapes and lives in this 2-room trailer. They are undocumented.
How does it affect your schoolwork?
It's okay. It hurts a lot. I have to go to the nurse's office.
Can you do all of your schoolwork? Is it easy or is it difficult?
It's difficult.
Are there days when you can't hear very well?
Yes.
And what do you do?
I bend over and cover my ears because it hurts.
This is a story about sick kids living in third world poverty, just minutes away from some of the richest people in the world. Edgar's mother, Marta, is desperate.
The school district sent us to a special nurse. She told me it was urgent that they fix his left ear because he had already lost the right. On the 28th, when I took him to the doctor in Moreno Valley, they said they couldn't see him because we don't have coverage.
One doctor told Marta to take Edgar to Mexico for less expensive care.
He recommended I take him to Mexico for the operation because it was urgent that they operate on his left ear, and that he needed hearing aids in both ears, and that they should take out his tonsils because that is the source of his problem. They are infected and full of blood.
Without immigration documents, Marta can't go back to Mexico.
No, I can't, because if we go there, I can't get back here. I can't take him to Mexico. I'd like to take him. I don't know what to do. I can't go to Mexico. I can't.
Meanwhile, 11-year-old Edgar's hearing fades.
They just evaluated him for special education, and they evaluated him at the capability of a 6-year-old. He's in special classes. He can't read, he can't write well, and he can't hear well.
Teacher Michael Rosenfeld was born and raised in the farmworker town of Mecca. He's taught at Coachella Valley High for 17 years. He says kids fail for lack of basic health care.
I see students all the time whose academic performance is affected by lack of simple little health care issues. Students who, for example, have eye infections and are vision problems, and they don't even think to get it taken care of. They just sit there and fail. Our hearing problems. We screen for that sort of thing, but it may take a year or 2 for that to happen.
Lilia lives with her husband and 8 children in this 2-room, 40-foot trailer. When one of her children gets sick, she says it's a choice between we eat or we see the doctor.
We don't have the money to pay a doctor and food for my children. The school won't take my kids when they are sick, and I can't take them to the doctor because I don't have any transportation. And they won't see them since I don't have any insurance or money. This boy had problems with his ear. I didn't have the money for a doctor. He got worse. We went to the clinic. It took a whole day. But because it cost $75 and I couldn't pay it, he didn't get seen. My children, the littlest one right now has something wrong with his mouth, but I can't take him to the doctor because I don't have the money. There are 10 of us. When this one got sick, she was covered in a rash. It happened at 8 at night. My husband was not home. A neighbor took me. She was all covered with rash. I also told the doctor I didn't have any way to pay her or buy medicine.
Days later, Lilia borrowed the money and found another doctor to treat her daughter. 13-year-old Tony says he misses a lot of school because of illness in the family.
I cut my chin. We went to Mexico because we didn't have any way to go to the doctor here. They cured me.
But they have to take a day off from work and a day off from school to go to Mexico.
I miss a lot of school, and I don't get good grades. Sometimes I miss out on tests I need.
Sick kids of working families are falling between the bureaucratic cracks. Medi-Cal and the Healthy Families programs are virtually closed to undocumented kids.
Medi-Cal has its limits, that you have to be having a certain income or no income in order to be able to qualify. So that then rules out a lot of people. The next program would be Healthy Families. But Healthy Families also has its real strict limits of income.
Remedios esta sopa revive a cualquiera. Healthy Families y un caldito te hacen mucho bien.
And once you make $1 over that amount, even if it's still not a very good income for the size family it is, you're still out of luck.
Teacher Mike Rosenfeld gets angry when he hears people say that undocumented children should go back to Mexico to get health care.
Well, the only thing I can think of is that, they may be undocumented, but they're here, and they're here to stay. And one day they will be documented, they will be citizens. And they're going to be ill-prepared for two reasons. One, they're missing a lot of school. That's one thing, so they're not going to get that preparation. But more importantly, they're going to grow up feeling like third-class citizens. It creates this gulf between the haves and the have-nots.